Hello and welcome to the Supportive Care Services Virtual Lunch and Learn series. My name is Vonsell Hunter with the Ironwood Cancer and Research Center's Marketing Department. The Supportive Care Services Department has created a series of virtual lunch and learn videos to help you be successful when navigating your cancer journey. Our Supportive Care Services Department is here to help you get actively involved in your healing process. For more information about the Supportive Care Services Department, please email socialwork@ironwoodcrc.com. Today's featured speakers are the Ironwood Cancer and Research Center social work team, Jessica Wells and Nicole McAllister. Their presentation today is Depression During Cancer and Survivorship. Let's all welcome Jessica and Nicole.
Welcome. We're so excited to have you join us today as we share with you some information about depression and ways in which you can overcome it.
Hi, I'm Nicole. I'm your West Valley social worker.
And I'm Jessica. I'm the East Valley social worker.
And we have a little presentation that we're going to share with you, and then we're going to talk and do some demonstrations. All right, so we have a little presentation for you, and we're going to give you some facts about depression and kind of talk about what does it look like and is it okay if you have it, and then what to do about it. We're also going to just really kind of spend some time really focusing on how you can treat your depression and overcome it, as well as do a little brief demonstration with a couple different techniques that Jessica and I like to use. So you are not alone. Psychiatric illness is definitely a part of the cancer journey. A lot of patients experience depression and anxiety. It's very common. Up to 50% of cancer patients experience some form of emotional distress. Physicians clinically diagnose about 20% of cancer patients with depression. In a population where people do not have a cancer diagnosis, the prevalence of that depression diagnosis is about 6 to 10%. However, the actual number of individuals who experience depression is likely a lot higher. And this is because a lot of people don't feel comfortable sharing, or they minimize their thoughts, or they don't understand what they're experiencing is depression, so they don't talk to their doctor. A lot of patients come in and their doctor asks, "How's it going?" "Oh, fine." And that's one way to deal with it, but also we can't fix problems we don't know about. So we really want you to be open and share with your doctors what's going on, what you're feeling, what you're experiencing. Talk to your social worker. We can help as well. We want to make sure that if you are experiencing depression and anxiety, that we can help you get some treatment for that. Poor recognition of depression and anxiety can also be related in some of the trials and studies to reduce quality of life and survival rates. So your emotional well-being is tied to your physical health. We believe in the mind-body-spirit connection, so we want to work on that emotional wellness. Depression in cancer patients receiving end-of-life care is no more prevalent than in patients living actively with cancer. I thought this was an interesting fact that came out of a study, because you would think maybe those patients who are experiencing end-of-life care would have more depression, but it's the same for those that are getting treatment, have a curative diagnosis. So it's common, and we can help you recognize that and help you do something about it. Some people may have more difficulty adjusting to the diagnosis of cancer than others do. Sadness and grief are very normal reactions. All people can experience these reactions periodically. So what does depression look like? It can include feelings of sadness, hopelessness, a loss of interest or pleasure in activities, things that you really enjoyed doing before. Maybe you have very little interest in doing them now. Maybe you used to sew or knit or crochet, and now you just don't want to do that. Maybe you enjoyed doing date night with your husband once a month or once a week, but now you just don't put a lot of effort or show a lot of interest in doing that. Cooking, maybe trying new recipes, that was something you liked before, and it just kind of fades away. Weight loss or weight gain can be a physical symptom that you might be able to recognize. Enduring fatigue. Enduring fatigue is that kind of daily struggle to get out of bed, always feeling tired, maybe taking more than one nap a day. And it's not related to the actual treatment you're taking, but it's just seems to be prevalent. We want you to kind of have the energy to get through your daily functioning, but when fatigue interferes with that, that's a concern that we want to address and see if there's ways we can assist. Becoming easily agitated or swift mood changes. One minute you're happy, the next minute you're angry and you're yelling at somebody, and then you don't even know why you're upset in the first place. Those kind of mood changes are something to watch out for. Trouble sleeping, your sleep pattern, maybe getting up every couple hours, or when you do wake up, you can't fall back asleep and you're awake for several hours and then you fall back asleep again. Sleep is such an important thing for our bodies. It's when our body has a time to rest and repair. And when we don't get good sleep, it can really affect our overall well-being. Trouble focusing and making decisions, kind of that brain fog, but not the chemo brain, but just, I can't decide where I want to go to eat. So I can't decide what I want to have for breakfast. I can't decide if I want to wear this shirt or that shirt today. Those kind of decisions that are really easy to make might be very difficult if you're depressed. Feeling guilty, helpless, or worthless, or having suicidal thoughts. And this is a very, very important topic. We want anyone who is experiencing suicidal thoughts to reach out for help. It's okay to reach out for help. It's okay to have these low thoughts and be in that place, but you need to seek help if you're having thoughts of harming yourself or harming others. And Jessica's kind of going to talk now a little bit about what you may experience in different phases of treatment regarding depression.
Thank you, Nicole. So in the beginning, what does it look like? Getting a cancer diagnosis can be very, very traumatic. So your initial response may extend over several days to weeks and can definitely include feelings of disbelief, denial, despair. A lot of times patients describe it as being in the middle of a bad dream and feeling like they're waiting for that moment of which they're going to wake up, but it never really happens. That's something that's very normative. You can also maybe struggle on the decision of who to share with your diagnosis with, and that can cause significant stress. Sometimes you may feel, overwhelmed by people reaching out, or feel like maybe going to Facebook and making posts about it to let everybody know is the best way to meet the masses. We always encourage you to do whatever is going to be most meaningful and honoring to and for you in regards to sharing that type of information. You may also have fear of what's going to happen during treatment. Is my hair going to fall out? Am I going to have nausea, vomiting, diarrhea? And am I going to lose weight? Am I going to look sick? Am I going to look like I have cancer? All of those types of unknowns can be very debilitating. Again, like I said, the unknowns, not knowing what to expect, not knowing what to happen. I think a lot of times people default to what they see on TV in terms of someone who's going through cancer treatment, and it looks very different. Also the tests, scans, appointments, and that overall feeling as though you've lost control of your life and your schedule. Now having to fit in the chemotherapy, regardless of whether it's weekly, bi-weekly, every 3 weeks, monthly, what that looks like, in addition to all of the other supportive appointments that you might have. During treatment, it's very common to experience those physical side effects, which may include, again, anemia, a vitamin deficiency, trouble sleeping, like Nicole mentioned, that fatigue, pain, and any changes in appetite. Chemotherapy does have the impact to change the way that things taste, which can then lead to a lot of patients not really eating because there's nothing that really tastes good or sounds good or things like that. All of these can contribute to feelings of depression and or anxiety. And I think it's important, like Nicole noted, for you to know that you're not alone. There is help and supports that are out there and available to and for you. one of the questions that can also come up is, what's the outcome of my treatment? What's that going to be? Will my cancer be able to go into remission? What if it comes back? Those types of thoughts can often come up and be prevalent in the mind. Physical changes that your body experiences. Again, losing any type of weight, a weight gain, if you have steroids included in your regimen, loss of hair, and what that may look like if you decide to wear a wig. That concern of, oh my gosh, are people going to know that this is a wig on my head? Those types of things, and any potential surgeries that may also be related to the treatment that you're undergoing. So as we previously noted, any of these things can come up at any period of time, whether it's initially when you're diagnosed, during treatment, or after treatment. Again, fatigue, any hormone therapy that you may have to go through, whether you are, someone who's impacted by breast cancer, there's a lot of hormone suppressant medications, or prostate cancer, whether it's Lupron or something like that, how those hormones can interact with your body can definitely have some changes as well. Again, noted the weight gain or loss, those physical side effects again. Changes in sexual function, which I think sometimes aren't openly talked about, that does have an impact on your life and can be hard to discuss with loved ones or even your medical providers. You may not feel comfortable mentioning that, but it is definitely important to do so if you feel like it's having an impact on your romantic relationship. Neuropathy, that pins and needles sensation in hands, fingers, toes, legs, lips, whatever it may be. Social circles and relationships. I hear from a lot of patients sometimes that they get diagnosed with cancer and their close friends just kind of disappear or don't check in on them, and those types of things that can bring up a lot of additional feelings to where you feel alone and you feel isolated in a time in which you most need it. Scars and surgical changes. For example, thinking of someone who's undergone a double mastectomy with reconstruction, there are going to be some scars that are included and some physical changes in your body and appearance. Of course, the fear of recurrence, which is something we shared, tends to be very prevalent in one's mind. Is treatment going to be successful? And if so, for how long? What if it comes back? What if it comes back in 5 years, 10 years, 15 years, 100 years, whatever the case may be? And then last but not least, financial stress. I think it's rare that people save up for medical emergencies. And so the financial stress of meeting co-pays, deductibles, out-of-pocket maximums, all of those can be contributing factors to depression and anxiety that one experiences.
There's a lot of myths about depression. The first one, we listed a few of kind of the most popular myths. The first one is that everyone with cancer becomes depressed. It's not true. There's some people that really have those natural coping skills or have been through other things in their life and they've really developed ways and they have really great support. And there's some people who do experience it. Either way, it's okay. Men do not get depressed. I think it's true that men and women sometimes express their emotions and feelings a little differently, but men do get depressed. We see a lot of male patients who are kind of having struggles, and that's okay. It doesn't make you any less if you do experience depression or you are struggling. What shows strength is that you can recognize that and ask for help. My emotions aren't severe enough to need help. Whether you're struggling a little or you're struggling a lot, we just want to know that you are having those concerns and that we're here for you. Depression and anxiety come hand in hand. Just because you get one doesn't mean you're going to have both conditions. Having a good prognosis means you won't get depressed. There's a lot of people who experience low stages of cancer who get scared, who worry, who still have all those same concerns that somebody with a stage 4 diagnosis may have. It's okay that because your cancer was only one spot and was caught quickly doesn't mean that you don't have the right to kind of worry. Support groups are good for everyone. Some people don't do well in groups. Some people prefer that one-on-one connection, or maybe a mentor or just a peer support. Some people thrive in support groups and really like hearing from others who are experiencing the same thing and kind of connecting with others and forming that bond and that new friendship. Being anxious means you have a psychiatric problem. Anxiety is a part of daily life for everyone, and anyone can experience anxiety in different forms and different levels. Just because you have cancer doesn't mean you're going to get it, or doesn't mean that it's going to be a strong anxiety issue or something that's clinically diagnosed. But we do have ways that we can work with you to help reduce those symptoms of anxiety. Depression lasts forever. It doesn't have to last forever. There's interventions and evidence-based treatments that can be put in place for you so that you can overcome those low moments, those sad moments, those feelings of blues. Depression makes you incompetent. A lot of people live their lives and function with depression, with anxiety. They're still able to hold down a job. They're still able to manage their family and run their household. It doesn't mean they're not experiencing depression. It just means they're able to complete that balance. People with depression want to be alone. Some people with depression want to be alone, but a lot of times they're looking for support and they don't want to be alone. They want to have people around them. They want to have that support.
So, treating your depression, what can you do about it? What help is out there? What are some techniques? Nicole and I are going to share with you some different tools, tricks, etc., on how to help manage some of your depression-related symptoms. We will note that these are not all-inclusive, and not everything works for everybody. Sometimes there are people who need to have a medication in conjunction with some of the tools and techniques that we'll be sharing with you. If you do feel that that may be the case, we would definitely say to speak with your treating physician so that they can help you explore this further. So before we get into the things that are helpful to do, let's talk about what not to do. Number one, please don't avoid the issue and hope it will go away. Higher levels of anxiety rarely alleviate without confronting the problem at hand. I know sometimes people take the ignorance is bliss option, and it's really not. And depression and anxiety tends to be one of those things where if you can kind of get a handle on it sooner rather than later, it can be more helpful for you. Don't minimize your feelings. It's okay to not be okay. I know sometimes it can be hard if someone's like, hey, how are you doing? To just be like, oh, I'm fine. It's okay to say I'm struggling today. Or, that doesn't necessarily mean that you have to talk about it, but just saying, thank you so much for checking in on me. Today is not a good day. I'll follow up with you when I'm having a better day, or something like that. And definitely don't rely on alcohol or any other substances to help reduce the depression or anxiety. Self-medicating, rarely helps to improve symptoms. And if they do, it's very, very temporarily, and you're masking the larger problem, which can then contribute and add up to even more problems. So what can you do? Like I said, Nicole and I will share with you a few things. Sometimes just utilizing deep breathing techniques. There's so many different methods. I was talking to a patient the other day, and she's like, I can't remember if it's like hold for 4, hold for 6, whatever. Again, there's so many different techniques that talk about what the science is. So for example, you can do 4-4-6, which is breathing in for 4, holding for 4, breathing out for 6. If you can't remember that, just taking a good deep belly breath is going to be far more important than how long you're breathing in, breathing out, or holding it. A lot of times we can shallow breathe and not really understand that we're doing that. So if I were to say right now, like take a deep breath and just like breathe out all of the air, as you can see Nicole demonstrating, you'll probably realize, oh, hey, I wasn't breathing to my full lung capacity. A lot of times we're just kind of breathing and we think we're taking a deep breath, but when we really pause and release the air, it really allows us to kind of fill our lungs up. And as we take that breath in slowly and then holding it, even if for a period of time, and then releasing it, we're sending signals to our mind to say, hey, calm down, relax. So Nicole, do you want to demonstrate the 4-4-6? Because I talk and breathe at the same, hold my breath at the same time. Okay, so Nicole's going to model for us how to deep breathe. And you guys, again, it doesn't have to be perfect. You can, and sometimes if it's helpful to you, placing your hand on your chest, on your diaphragm, something like that to feel the rise of your breath and the lower as you let it out. So ready, Nicole?
Okay. So it always helps. Number one, your inhale is going to go through your nose. Your exhale is going to go out your mouth. Your inhale should be shorter than your exhale, because that's really where you're going to release that tension and that energy is through that exhale. So 4-4-6.
Yeah.
So you're going to start off with a 4-second inhale.
Yes. 4-second inhale. Ready? So breathe in for 4, 2, 3, 4. Hold it. 3, 2, 1. Out for 6. 5, 4, 3, 2, 1. Super easy, you guys. And then you just repeat that however many times that you need to. Again, you may Google it and it may say, oh, I read something that said 4, 6, 7. That's fine too. Depending on what your diagnosis is, holding your breath for an extended period of time may be something that's beyond your capacity. Please don't push your limit. Listen to your body. And again, it's more about, like Nicole said, that breath in through your nose and then out through your mouth. So deep breathing is definitely something that you can do. Guided imagery, that's one of my favorite things to do, can be super, super helpful. And it's a combination of calming mixed with distraction, but kind of like a healthy distraction, so you're not completely ignoring the problems. So I would say pick a happy place if you have one. Make sure there's no negative associations that you have with it. I love to use the beach for my guided imagery because the sound of crashing ocean waves are just the best thing ever. And so then you just kind of walk yourself through it. So in my guided imagery, there's always a nice cool breeze, the crashing of the waves. Sometimes I envision like a seagull flying overhead, but not too many because that gets noisy. And then think about, what does the wind feel like on my arms? What does the sand feel like between my toes? What does it feel like if I'm walking along the shore and the crashing of the waves kind of comes up and hits my ankles? And as I'm thinking about all of that, I'm taking some deep breaths, using that deep breathing technique. Again, I'm not counting the breath at that time, but just deep breathing and allowing myself to kind of visualize the beach or whatever the happy place is. And that can be super, super helpful as well. If you find that you kind of struggle to create that image yourself, there's tons of apps and things that are available. Headspace, Calm, YouTube has a wide variety of guided imagery, meditations, etc. So if it's a day where you're feeling anxious, you could go to YouTube and put, guided imagery for anxiety, and they'll walk you through a peaceful scenario. Same thing, guided imagery or meditation for depression, those types of things. You can get very specific and they will have guided tools there for you to be able to utilize.
I know I personally can share that I struggle with MRIs and CTs and kind of the tight space. And I didn't realize it till the first time I had to get an MRI, and I got all the way in and they were getting ready to start. And I was like, get me out right now. I can't do this. And I had a total panic moment. And I was like, how am I going to do this? How am I going to get through this? And guided imagery saved me. The first time I then, did the MRI after that was with the open MRI, and I kept envisioning I'm in a pizza oven because of, the way it's shaped and it's wide and it's open. But that was okay because I had pizza on the beach and I was thinking about it cooking and how it tasted and how it smelled and what drink I was having with my pizza, and the same thing, the sand in my toes. And it totally just had to take myself away. I have to wear a mask in those machines just because I'll open my eyes. And once I open my eyes, sometimes that can ruin the moment. So I keep my eyes shut. I just take those deep breaths and just envision where I want to be. What does it smell like? If you're on the beach, do you smell that coconut suntan lotion? Just every little detail, and really focusing on that and taking yourself away from that moment. It's so important and so helpful to kind of get through some tough spots.
Absolutely. Absolutely. And the beauty of these things is you can use them anytime, any place, anywhere. You don't have to physically carry anything with you. You don't have to have a huge setup. You can do it in the waiting room, as you're waiting to be called back for, like Nicole said, an MRI or a CT or a PET scan, or waiting to get the results back of those tests. Sometimes anxiety increases in those moments where you're waiting to hear the results of, oh my gosh, his chemo or radiation hasn't been working. What is this going to say? Some of those fear of the unknowns that we talked about earlier. But these are super quick and easy that you can do without anybody around you knowing that you're doing it. So.
Absolutely. I want to talk about for a little bit individual counseling and how you can really benefit from that. There's often a stigma with people who go to counseling that I'm crazy. That means I'm crazy if I go to counseling, or if they prescribe medication to me, then that means I'm crazy. You're not crazy, and you're definitely not alone. A lot of people seek help, and that's okay. The great thing about counselors is they're a neutral party. You tell them anything you need to. You share your feelings, your darkest fears, your worries. They're not your family, so they're not gonna respond emotionally. They're not going to look terrified. They're not going to cry. You're not going to have to stop and take care of them. They're going to listen to you. They're going to support you. They're going to help process those feelings. They're going to help you set some goals and some tasks to achieve those goals. They're going to work on strengths you already have just to build you up. Everyone has a foundation. Sometimes it's harder to see that foundation, but the counselors are trained to kind of identify those skills, those strengths, those coping mechanisms that you already have, and really take those to the next level to help you get through difficult situations. They also are very good at triggering things that may be stressors or things that are kind of making the situation just a little bit worse, and they can kind of identify those because they're looking from outside the picture. They're not directly involved, and so they can see the bigger picture. They look at your support systems, they look at what's what needs work, and kind of come up with this plan with you to work on those things. And so counseling can be very beneficial, and that's definitely something we can help. I know Jessica does some counseling here in relationship to adjusting to your diagnosis, but we can also assist with getting patients hooked up with somebody in the community through some resources that we use that work with your insurance, or if you want to pay cash. There's all kinds of options out there, but we want to get the best fit for you, because that's what matters, is kind of getting the help. Some people don't feel comfortable talking to a female, so they want to talk to a male. We can help you, or vice versa. They want to talk to a female because they don't feel comfortable sharing their emotions and feelings with a male. Maybe they want to talk to somebody their own age. Maybe somebody says, I can't talk to somebody who's the same age as my daughter because that would feel weird. That's okay. It's okay to have those things. And that's part of the conversation that we do as social work, is finding out what's going to work best for you. We don't want to put you in a group setting if you hate working in groups. If you don't want to work one-on-one and you want to start off in a group, that works too. Again, it's about finding the best fit for you to treat your depression, to treat your anxiety, to kind of help get you through this journey.
Absolutely. And to just kind of, reinforce what Nicole was saying too, one of the things we can also do is give you information on how to pick and identify a good therapist or counselor. just because, like Nicole said, not everybody is a good fit, and it's really important to have a good therapeutic fit. And when I say therapeutic fit, I mean somebody who's able to maintain the therapeutic relationship by setting boundaries for you, right? You shouldn't know all about their family drama and their life and what's going on with them and so on and so forth. There will be some, maybe mini disclosure during the report building, right? If I'm like, hey, Nicole, what did you do this weekend? How was your weekend? And she's like, hey, I went to the botanical gardens. And I'm like, oh, I've been there before. Isn't it beautiful? That's a lot different than Nicole being my patient. And I'm like, oh my gosh, Nicole, let me tell you about this trauma that happened to me when I was 13. And then now Nicole is having to TLC me when she's the patient. So just those little things we're able to give you information about, and also provide you with tools on how to end a relationship with your therapist or counselor if you feel like it's not a good fit, so that you can find somebody that will be better in that regard.
So I want to demonstrate something that's a good energy releasing technique. And I learned this from one of my patients actually, and spent some time kind of researching it, but we do it in our breast support group on occasion to start the group off. And that's body tapping. And so body tapping is something very simple that anyone can do. It's just a couple minutes a day, maybe a couple times a day, or just if you're having that moment, and it helps to release those negative energies. So our body has these energy points all over, and there's certain areas that kind of affect mood, anxiety, stress. And so those are the ones that you can focus on. I'm not going to show you all the body tapping because that would require me to stand up and do a full thing, but I'm going to show you a couple ones that I think are really good, especially for our patients. So tapping with your head, and I will show you in a second, but people who are experiencing chemo brain, fatigue, migraines, kind of that stress and anxiety, one of the best places to focus on is your face and your head. There's a lot of points in there. Right here, kind of the start of your eyebrows, is one of the sensory points. The top of your head is a sensory point, and kind of that base of your neck, there's another one there. And so there's some really good ways to do this light tapping. Now, we don't want you to hit yourself so hard that it hurts. You're doing it too hard if you're doing that. But we also want you to use enough force and enough pressure that you're actually feeling that. And it's very gentle. It's very rhythmic. So you're just gonna tap, 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 tap. Real simple. So on your head, you're gonna start off at those pressure points right here. You're gonna go across your eyebrows. And you're just gonna go to the very edge of the temple. Then you're going to move your way back up to that center hairline. Excuse the hair. And you're just going to go back. And you're going to go all the way down the back of your scalp to the base of your neck where it starts, and come around. And you're just going to kind of go around and just kind of open up, wake up all those blood vessels, kind of stimulate those muscles, go around, come back down. Over. Now, if you're having sinus issues, a really good place to do that tapping is right here on your cheekbones, on your nose, very gently. Don't forget that chin, and just get all those facial things, because you're waking up everything and you're stimulating that. On your arms, you can tap pretty hard to kind of release. You got lymphedema, you got some pain, some buildup in there, the scar tissues after a surgery. Just going to go inside the arm, outside the arm. And again, like if you spend a couple minutes and you start at the top and you work your way all the way down, don't forget your bottom, because that trigger point can release like that pain and that stress that builds up in your back. If anyone's ever gotten a massage, the best place to work on massaging to get rid of back pain is actually in your glutes, your bottom. And so make sure you're tapping that. Your pelvis holds a lot of source of strength with your core. And so that's a good place. Your feet, to tap your feet, you can stand in place and kind of lightly stomp. There's a lot of good videos on YouTube that demonstrate this. And that's how they always start, is the stomping, to get the feet going first. And you feel that energy. Close your eyes. You can feel it all the way up in your body. So just those little activities to kind of release that stress, that anger. Maybe you're having a moment where your mood's starting to swiftly change. If you can step aside and recognize it, and just spend a couple minutes doing some tapping kind of across your chest, kind of around your gut, and kind of those places where you're feeling up, just loosen all up, kind of shake out those arms and just get rid of that energy, you can feel better. And do that a couple times a day and just kind of work out those muscles. It's not an exercise. Anyone at any age can do tapping. Again, you're not tapping to hurt. You're just tapping to kind of wake up all those sensory and nerves and muscles and blood vessels.
I love that. I was going to say, doing the face part, I feel a difference and just feeling like, ooh, a little bit more loose and calm. And like Nicole said before, you guys, these are all evidence-based. So it's not anything that Nicole and I are making up and sharing. These are things that have been studied by tons of people, and a lot of research has gone into it and to study, you know, the impact and how effective it is. So
there's so many other things. We definitely encourage you to participate in support groups. We have a survivors group. We have a metastatic cancer group. We have multiple breast groups, some general groups. We have a group for you. And if you're looking for something specific that you can't find, we can help you get in touch with maybe another place that you could go that's reputable and has some good groups. Peer support groups are really great to connect with other people that are walking in your shoes, or maybe have had similar experiences that can say, I felt that way before too. Or when I went through radiation, this is how I treated my skin and it made it go away. Or this is the trick I learned from my nurse in the oncology infusion room. And this is how I dealt with my nausea because my dietitian told me this. Like, we have so much that gets shared in those groups. I learn a lot from our support groups. I hear things all the time. I'm like, oh, really? I didn't know that. Because everyone's having different experiences and they're sharing those. So those are very important. And working on your nutrition is good. Kind of fresh start to your wellness is looking at what you're eating that's good, what you're not. Are there foods you're eating that maybe are holding you back from having those good energy levels? Do you need to look at vitamins you're taking? Are you vitamin D deficient? And so there's a lot of different things out there that nutrition can assess and improve and increase. And exercising, whether exercising is just doing some chair yoga and Tai Chi, we have those videos available, but there's also a lot of stuff online right now. Unfortunately, with COVID, a lot of things have shut down, but also with people having immune systems that are compromised, all these virtual things have been great to kind of offer to patients and suggest and participate in. You don't have to go to a gym and be exposed to all these people sweating and breathing. You can stay at home in your living room and do a 10-minute exercise or a 30-minute exercise.
Absolutely. Absolutely. The biggest thing to remember is that you guys are not alone. I know a lot of times it can feel like you're isolated. It can feel like you're just out on this like deserted island and with nobody in sight. But there is help. There is help available. Nicole and I are both available to you as resources. Please tap in and get connected with us. I know Nicole had mentioned earlier, you know, reaching out if you are starting to have some of those dark thoughts, as I like to call them. You know, if you're having any thoughts of wanting to hurt or harm yourself, getting help. There is a crisis line that's available to you, and that's 24 hours a day. There's also a warm line, which is peer support if you need somebody to talk to, both of which are 24 hours a day, 7 days a week. So if it's in the middle of the night and you feel like you're struggling, you can definitely call either one of those numbers and they'll give you some help. The crisis line, that number is 602-222-9444. And then the warm line is 602-347-1100. So just know that you guys have that lifeline as well, 24 hours a day, 7 days a week.
I'm going to bring up on our screen kind of the ways to contact social work. There's a couple different ways. So there you go. So social work at ironwoodcrc.com or wellness at ironwoodcrc.com. Either one of those you could use and get to Jessica or I or our support services coordinator, Sierra Endicott. There's our direct phone number, Jessica's number, my number, and also on our main page at ironwoodcrc.com. We have a calendar tab up at the top. It shows all the events that we have going on this week and for the month. And you can see a color coordinated calendar there. Plus, we have lots of blogs and articles and videos and links to all of our social media. We've done a lot of videos on YouTube that are available where you can learn about self-care and taking care of yourself and nutrition and wellness and survivorship. All those are available. They're free to watch online. And you can get links to our Facebook page, Twitter, Instagram as well, and learn a little bit about our doctors. It's a very informative page. So all that information is there for you to have.
We're here to help, however, and to best support you. And we hope you all take care and be well.
Take care.
Bye.
Thank you for joining us for our virtual Lunch and Learn presentation, Depression During Cancer and Survivorship, featuring Ironwood social workers Jessica Wells and Nicole McAllister. We hope you enjoyed this session. There will be a replay of this Lunch and Learn on the Ironwood YouTube and social media channels. For more information regarding our supportive care services classes and events, please email us at wellness@ironwoodcrc.com. Thank you for spending time with us today.